So how's the week going for you, Eddie?
Week off was good, relaxed, and
Awesome.
yeah.
Well, once you're retired, every day's a week off, right?
Yes, sir, absolutely.
Awesome. So do you have any big goals for your retirement, or just...
No, just trying to go a few places that I haven't been and stay active.
Nice.
Mm-hmm.
Do you exercise?
I do.
Like what kind of stuff do you...
Just, a little weights and walking. Yeah, cardiovascular is
Nice.
critical at my age right now.
Weights too.
Mhm.
Weights are really important.
Mhm.
You drop a lot of muscle mass as you age.
Yeah.
So beautiful. And
Yeah.
you were telling me earlier that you're going to activate the insulin pump,
Yes.
which is
In
really
fact,
critical.
In fact, the gentleman's name you gave me that you referred me to.
Dr. Schlesinger?
Yes.
Yeah.
Well, him and as well as the cardiologist.
Cardiologist, Dr. Devane.
Right.
Yeah.
Out in Walnut Creek. I made an appointment with him as well. So everything's in the mix.
With diabetes, you have to be so proactive.
Man, really?
You really do.
Really got to stay on top of it all.
Absolutely.
You got to hit all
And
the
the problem is it causes stenosis or narrowing of small blood vessels.
Mm-hmm.
And the beautiful thing is that's what the Gaines wave actually repairs. That's what it fixes. So,
Yes.
So how did the Gaines wave therapy go last week?
That went well.
Was it painful?
It was not painful, but just a tad bit uncomfortable, being that it was the first time. And so, but I'm here and I'm looking forward to.
You're back, huh?
Yes, I'm back.
Didn't scare you away.
No, absolutely not. I know down the road it will be beneficial.
And would it take about 15 minutes, 20 minutes?
15, 20 minutes, that's it.
And we have the video monitors, you watch whatever you want. Just kind of take your mind off things.
Very comfortable, yes.
Absolutely. And you know that it's going to take about 4 weeks for you even to begin to start to see results.
Right,
So
right.
you just have to hang in there. But let me just tell you real quick what the shock waves actually do. So sound waves are kind of these gentle sinusoidal waves. So even when you go to the movies and they have like those bazooka tubes behind the seats and you feel the vibration, those are sound waves. So what a shock wave is, it's a lot more intense energy.
Comes at you like that.
Exactly. So the crack of a bullet or lightning and thunder or a jet breaking the sound barrier produces this really intense wave of energy that has a higher peak and a sharper drop.
Right.
And when that energy goes through soft tissue in your body, the waveform of the energy makes the body think that there's an injury that's been created.
Oh.
Okay, and your body responds with an acute inflammatory response that's a healing response. And that healing response activates a cascade that we'll talk about in just a second that causes the growth of new blood vessels. So we use these same waves to break up kidney stones, and those are focused waves. So the waves are all focused on the stone, but what we're using here are what are called radial waves. So it's as if someone drops a pebble in a body of water and those waves ripple out.
Yeah.
And so some brave soul about 8 years ago decided to try to use those waves on the penis. And what actually happens is the waves of energy stimulate what are called Schwann cells. Those are nerve cells. So a lot of men who undergo Gaines wave will tell me that they have better sensation. I can't prove that. I've heard that many, many times. And then the other thing it does is it causes endothelial microtrauma. So endothelium is the lining of blood vessels. And it's a critically important organ or lining because it causes the opening and closing of blood vessels depending on what signal it's producing. And that signal is nitric oxide for the most part. It also activates stem cells. Stem cells are cells that become other cells. Nitric oxide gets released and vascular endothelial growth factor gets released. So vascular endothelial growth factor is a growth hormone that your blood vessels produce that tells the body to produce new blood vessels. And that's what it's all about. It's about growing blood vessels.
Okay.
And so, let's see.
Yeah. From like the stem cell aspect of it.
Exactly. So stem cells work two different ways. Yeah, so the rusted out card. So the purpose of this slide is basically, there are patients like if you've had type 1 diabetes for 20 years, or if you have really bad cardiovascular disease, those cars are sort of beyond repair. And there are other things that we can do as urologists, like penile implants or vacuum erection devices, to rehabilitate those patients. What we're looking for are these classic old Thunderbirds that we can rev up and turn into high performance machines. So if you could have one car in the world, what would it be?
Wow, man. I'm a Cadillac man.
Really?
Yeah. And I want a 1968 with the drop top.
Really?
Yeah.
Oh.
Yeah.
I want like a cruising car.
Right. With some big wheels up. I used to have one years ago, and I just never got over that. As well as I like Buicks too. 225 electric. They call it Deuce and the Quarters. Yeah, those two I like. 1966.
Yeah, growing up, my next door neighbor had a big old Eldorado.
With the long front.
Yeah, the long front. It was like a boat.
Yeah, that's how they
It took like a lane and a half.
With the short end in the back and the long front. Yeah,
Exactly.
my uncle had one.
Exactly. All right. So in your situation, we're going to do 12 treatments for you. And we'll have you put on a little bit of that numbing cream just to kind of take the edge off. The treatment lasts about 20 minutes. And the beautiful thing is afterwards you can go back and do whatever you want. Right. You go to the gym. And then tonight, if you want to have intercourse or try to have intercourse, remember it's not going to really effectively work for about 4 weeks. But there's no restriction.
Business as usual.
The most important thing is no non-steroidal anti-inflammatories. So no Motrin, Advil, ibuprofen. If you have a headache, take Tylenol.
Okay.
And then we treat both sides of the penis, the outside part of the penis and the inside part of the penis. So anatomically, half of the penis is on the inside and half of the penis is on the outside. So if anyone ever asks how long your penis is, take the outside part and double it. Okay. And then if they're like, well, where's the rest of it? You can just say, well, it's on the inside. Right, okay. I got you. What we're doing is we're hoping to get your blood vessels from looking like that.
Yeah.
To looking like that.
Yeah, there we go.
And you're taking the Affirm?
Yes, sir.
2 tablets
twice a day.
All right, perfect.
One in the morning, one in the evening.
Beautiful. All right. Well, why don't we get you started?
Okay.
Beautiful.
All right.
Good to see you, Reggie.
Thank you.